you. All right, so let's move on. Questions?
I have one for social services.
Yes.
Okay, our biggest problem for patients or for.
Can you tell me again from finance?
I'll let her hop in. Our biggest problem is people not being compliant and taking the documents in. Are you guys looking into being able to scan these documents into you guys where the patients, the people don't have to go in? Lack of transportation or they're just not compliant?
So so your patient that's at the hospital?
Yes. So are we gonna go on the internet, people will apply for them, scan the stuff to them, so you guys can work the applications?
We are scanning documents.
But they have to go actually to the.
Right, but, okay, so some of the documents though that are required, I don't think they're gonna have with them at the hospital.
Okay, for example, if they're admitted, and family bring in the documents that are needed, are we gonna be able to scan them and send them to you guys to be able to work the application?
We can scan the documents. There's some documents that we have to actually see an original and check off that you provided that original document. But in we'll work closely together. If we have to have somebody, we'll work together so that can get done. Yeah, but we do scan the documents, yes.
So it will be able.
Yeah. It's just some technical stuff that we're gonna have to work out. That's a requirement, but we used to have eligibility technicians out in the hospitals, I remember. So, but we're gonna do whatever we can, combining resources, to get it done.
Or social services, for when the new implementation comes around, are you guys gonna still have shared costs?
Can you repeat the
Okay,
question?
the
please, so
shared
everybody else
costs.
can hear?
The high share costs.
If you're
All
gonna
right.
still have shared costs, patients, or clients or customers?
Now, and some of you might know the more technical. Now, so your question is, she wants to know if there's going to be a shared cost. Remember, there's different programs.
Oh, she's asking if what,
Is there-
wait, is
there
there
gonna
gonna
be a
share
shared
cost
cost?
when the Medi-Cal expansion hits?
Right, there may be, not necessarily a Medi-Cal share cost, but under certain plans, there's going to be a premium that they'll be eligible for subsidies.
Right, but for
So-
Medi-Cal, there was not.
I think that if I can answer the question the way I understand it right now, we will have Medi-Cal managed care, and depending on what type of a plan is going to, there might be some expense involved or not.
That's true.
Relative to the Medi-Cal managed care, I'm assuming 35,000 new people going into it, the two programs. How's the enrollment of the private providers going? Are they enrolled already? I mean, has the program, or is this going to be more or less a closed-off program?
No, it's not a closed-off program. There are two managed care programs that are coming into the county. California Health and Wellness actually was the one that was identified and has been working with the different clinicians, the doctors in the community. Molina is a relative newcomer. They just got approved a couple of weeks ago, and they are working on their provider enrollment at this time. But they're still working as number one is the starting date for both the plans to be up and running, and it's in progress. It's a work in progress.
A follow-up, the third-party coverage for pharmacy services is currently going to be similar to what Medicare Part D in terms of using an actual independent insurance agency. Is that true?
I mean, I don't really have a good understanding of it. It will just depends on those two managed care programs that are here in the county and how they're going to implement that.
Okay, I'm going to go by turn. Would you, and please do stand up when you ask your question and try to speak loud because we are recording it and you can hardly hear people's voices back there. And if you, I'm going to ask of the speakers, if you don't hear the question, I mean, if it's too low, please repeat it so that everyone else can hear it and also so that it gets recorded.
Peggy, my question is to you. With regards to the expansion of Medi-Cal to those between the ages of 18 and 64, you said that the umbrella is getting larger and that some of them will be enrolled in regular state Medi-Cal as opposed to CMSP. Can you tell us who will not be eligible for the CMSP? Or excuse me, who will not be eligible for the state Medi-Cal conversion?
You know, it's difficult to answer because there are eligibility requirements. But in general, most people are gonna be covered by Medi-Cal that are under that 138% federal poverty level. Yes, so.
It is my understanding though that part of the legal permanent resident that have been here under 5 years will not fall into that. And so that's where they would go towards Cover California. So yeah, so
The 138% and then immigration. How long is the immigration?
She's next.
Dr. Begg, at your clinics, do your individual providers have to be registered with Molina and the other insurance group, or is it registered by the clinics?
We are working on the contracts right now, and basically what we want to do is it has to, what we are working on is it has to be by Clínicas de Salud as the umbrella organization, because our clinicians are, you know, sometimes they may be with us for shorter periods of time, and also most of our patients have a tendency of using different clinic sites, but it's a work in progress as far as the healthcare plans letting us do it. But our preference is that, say, that the contract be with the clinic.
So the individual providers do not also have to be,
Because the way Clinicas is set up, all the clinicians, the doctors, nurse practitioners, PAs are staff members. They're all employees of Clinicas. So that's the reason why we are working with the plans to make sure that Clínicas de Salud is the one that the contract is with. So the patients will be able to access care, you know, wherever they need be. But we do want, as far as patient education goes, we want them to go to a designated clinic and utilize a clinician, because that will definitely help us in implementing the patient-centered medical home that we are working on right now. So, I mean, even though we want to, on our side, we don't want to be a barrier to the access of care, but from the patient side, it's best if they go to one clinic. So we're working from both ends.
Peggy, I totally agree with you that there's going to be some duplication of efforts. And my first question to Robin this morning was, how do we help families transition from this Medi-Cal to managed care? And I'm concerned that there are multiple people in this room that share cases. We share many of the same families. And what do you see, Peggy, as the most efficient way to help families transition if we share cases with DSS specifically? Because we do a lot in this room for the many of the same families.
Yeah. Josh?
Yes.
So you're co-located with us.
Yes.
Want to stand up? Now, you weren't part of the presentations, but you're here for questions.
Right.
They are co-located with us to help explain to Medi-Cal recipients which plan that they are going to choose.
Right.
So, again, we have several staff that will be co-located in all of our offices to assist clients with that. Now, Rosie, in terms of who you're working with or the hospitals, we are trying to set up a phone bank where we can filter calls so that we can decide what's the best way to do that. So a lot of it is, you know, we're really trying to do a lot in a short amount of time, so apologize if we don't have all the answers for you, but that's why we're here today. And we'll continue to work very closely together so that we can do that. So we do have different venues, groups of people that we can do that. We're talking about, in terms of our building, is setting up a resource room where we can, people can come and we'll have lobby management people that will be walking around to answer questions or guide you in the right direction. But we really do need help from the community, because we're not going to be able to service everyone. There's going to be a lot of wait time and things like that. So it's just so important for us all to learn what we can, like Robin said this morning, to attend trainings or venues such as this, so that we can work together. And it may be getting a small group of us in those different venues or groups that we have and working out a plan to do that. It may be having one of our workers and Josh, your staff, I'm sorry, I want to call you Maximus, but I know that's Covered California Options, or California Options will, that's their role in all of this. They've been assigned by the state to do that, so.
They're in your office?
They are co-located with us, yes. In all of our, wherever we're at, they'll be there with us.
Okay.
This question is for 211 and Catholic Charity. You guys mentioned that you're going to do outreach, but what kind of outreach you're going to do for the really hard people to find, like the homeless, people that lives in Mexicali across the border?
Well, I guess it would depend on their eligibility. Depending, like homeless, if they make below 100%, they don't have to enroll in Covered California. We try to promote Medi-Cal options, but it's not necessarily needed for those below. And we just would want to make sure that they're residents of California. For Mexicali, we're hoping to do a lot of outreach events that are in this area and that for those that are affected. And we need your help to find out which events that these people will be at, because they have to be a resident of. So people that go across the border, if they live in Mexico, they wouldn't be eligible to be a part of Covered California. So it depends on the residency, and we want to make sure that they can.
But they would be eligible for Medi-Cal, right?
Well, they are California residents, they are US citizens in some cases, and have been residents, a lot more than 5 years. If they reside over there, if they work over here, they have every benefit, actually.
So I think to the question of how are we going to be at the specific
outreach to
events,
them.
that's why we're here, because you guys know about events that are going on in the community that you want to invite us to be a part of it. And so we don't know the events, but you might know the events, or you may know other people that can connect us to say, let's make sure that Covered California, whether it's Catholic Charities through their outreach or 201 through our outreach, we get invited to be there so that we can be in front of them and help them.
I have another question, and this is for Peggy. You mentioned that you have staff in Calexico, and do they help people with all the paperwork? Or
Staff down at the, we have staff at the Family Resource Centers, we have staff at the One Stop in Calexico, so yes, we do.
okay, but they get help with all the like if they want to go to your main office here in El Centro?
They may have to come to the main office because some of the systems that we need to use are there, and some of the most of the staff that we have in Calexico at the One Stop works with the clients that have already been enrolled.
Oh.
So, but we are working on a location to be able to provide the full scope of services. But yes, we do have staff there. They go and they, it's not it's a small amount of staff that's there, but we're gonna make business changes where the needs are.
Okay, thank you.
And sir, if you wanted me to just address Catholic Charities real quick, our outreach is really with the faith-based communities. One of the reasons why Catholic Charities was created back at the turn of the century was that the poor would basically go to their parish and talk to their local priest and knock on the door and say, I need this, I need this. The parishes were overwhelmed, and that's why Catholic Charities became the social service arm for the diocese. So we're really going to be at the local parishes and some in those hard-to-reach areas, offering services.
And I understand you guys have a male shelter over there in Calexico, but a lot of people claim they're homeless, but they're not at the shelter. They're out on the streets. So
We do see them there. We also see a lot at our different senior nutrition program sites. At the men's shelter in Calexico, we also do a senior food distribution, which brings in a lot of residents. So we're hoping if we can provide some print materials and let them know where and when in the community we will be, that folks can come visit us. We've got some laptops and hotspots that we can take out to different outreach locations where we can do applications right online. And assist with stuff like that.
thank you.
I have two questions. One for Peggy. Is the government doing the
Where are you from? I'm sorry, just so that.
Veterans Rep application? I'm the homeless task force chair,
Oh.
past chair.
Thank sorry.
The reason, yeah, they're asking that question because if you guys don't have, the 8:30 is our Cali Charities. At Cali Charities, we have our homeless task force meeting tomorrow. If you guys are welcome. Past sheriff, you guys are welcome to outreach as well over there with all the nonprofits agencies. My other question is that I know there's an IT. Well, right now with the homeless task force, we're working on a client tracker, and hopefully you guys could get on board with that as well. I know the county's getting on board where all those nonprofits could get into client tracking of all one database to get our grants. So that's my question. I don't know if you guys know about that.
I was told about that. As you know, we have staff that attends your meeting,
Yeah.
and we also have a board supervisor that attends that meeting, so.
Okay.
I know you guys are working together, that's.
Yeah, we're collaborating together on that.
Yes.
So that's why was my question, the IT part, you know. And third would be, hopefully 201 could help us collaborate with everything going on in the valley. You know, that's
And we're involved in a project similar in San Diego where the HMAS, all the homeless organizations through the Regional Task Force for the Homeless are bringing those systems together. And there's a number of initiatives that we're watching, because that would make our job easier. If someone could call 211 and we could say, have you been helped in the community, and we could pull up their client record from whatever system you might be using, we can help navigate them back to the organization rather than start from scratch. In a lot of cases, they just need to be pointed in the right direction.
My name is Araceli Gaines, and I'm working with Dr. Rashad at the Cancer Institute at Pioneers Memorial Hospital. And I have, from all the presentation, I just have a few questions. And these questions, they go, especially the population that we see now at the Cancer Institute. 85% are Medi-Cal. Now, as we know in the Imperial Valley, because of the needs, and something that I was looking at the 211, I see that the questions, or maybe some of the phone calls that you're receiving, is a very low number on health assistance. Well, not because we don't need assistance on health information and resources. As we can see, we have a lack of information for the community, because we know that some of these patients, they're probably not even concerned about changings on their status of this Medi-Cal, or with all these two changes, they're not even aware. It's a lack of education with the family. Some of them, they just initially started this transition to Medi-Cal before they were employed. So there is a very fragile population that we will encounter as servers, health providers. So what I like to know is the outreach is not just on the health fairs. Many of them, there will not be there. I did like the idea there will be 3 different ways of enrollment, which is the phone, the internet, and then in person. Now, and the reason is because if they call and if they try to change their enrollment, if they're already on Medi-Cal, it will be a little easier for all these sick patients, and we have many chronic diseases in the Imperial Valley. The other thing is that if we are going to do work presentations and educations for enrollment, the people needs to be knowing, be informed and educating before even attempt to go to this public presentations. And I like to know how the 211 can assist on doing this outreach, or if it's anything that they're assisting in doing this outreach. And this goes to clinicas. Now, the private physicians that they already see patients.
Let me answer that one first before you go to the next question, because were you here during the presentation, my presentation? So what I was trying to explain is they're not calling for help. They're calling for many different situations, and our specialists will be on the phone with them, and part of our contract is every single one of those calls to open up the conversation about health and to open it up. So even though they're not calling for health, they're going to get health education. No different than if they're not calling for food assistance, we're going to give them education because we're going to identify those individuals that need to know about the program.
So that means that right now we can actually address our patients and tell them to call 211, so that way they can start getting information on their resources. And I'm saying on their resources because we share patients that they started their treatment in Mexico. For other reasons, they come back over here. They're unable to get their documentations. They probably will go to clinicas for them to get a PCP, so that way they can come back to us. Now, everybody will have to be on the same health health program and plan for them to be continuing on this treatment, correct? Dr. Begg. Now, the information that you guys have right now, do you guys have who are the resources and oncologists, or how we can assist these patients? What will be the process for them to enroll in other programs? And
That's the beginning of what we're doing here, is really to understand how does the community, including our partners at the county, including how do you want us to handle those calls, is really what the formation of service delivery is all about. We don't just go out and answer a call. We need to have people involved, because it's all of you that we're going to be referring people to. And to do that well, you need to sit down and really figure that out together. And that's one of the conversations we're planning on doing.
If I can translate or address Araceli's concerns, she is working in a specialty, which is with oncology group, and her concern is that as part of the as part of the discussion that happens with people that are calling regarding signing up with managed care programs or whatever insurance that they qualify for, that this be flagged for them, that their PCP and their specialty that they needs to be on the same thing. So that might be something that they may not be sensitive to, that everybody has to be taking, because this is, again, it's a very new experience for our population. You know, San Diego has had managed care for a number of years already, but our population does not have any experience at all. So I think that is basically what Araceli's concern is, that this be flagged for the clients, that whatever you choose, make sure that everybody that you need or know that you need right now is on the same plan.
Thank you. Let me I sent this to our speakers. Alliance is very happy to convene a meeting with the players so that there can be this much more one-on-one dialogue. This is a big, this is a big meeting, and there's a lot of different issues, but I think there's key people that can come to the table, that can speak on behalf of others, and that we can get something going in the way of sharing information, collaboration, and structuring, a plan that we're all on the same page and everybody has a role to play in helping and getting assistance as easily as possible.
Just a suggestion for that.
Okay, can we wait on that, because there's been a lot of people waiting on us asking their questions.
Well, first I just want to thank the panel. You guys, these are tough questions, and this is a huge initiative, so I do want to thank you guys for taking these questions. I also want to thank Alliance Healthcare, because if it wasn't for them, we wouldn't be having this venue, so I do thank you. My question is, well, I have a bias towards this, but my assumption is that we don't have enough medical providers as is in our county, especially when it comes to specialty care. And I know there's a big outreach in terms of, getting them on managed care, but once we get these 35,000 on managed care, what are we going to do to service them? And are we reaching out to those medical providers and saying, hey, do you want to come to El Centro? Are you going to be offering services? Because it's taken, 30, 60 days to sometimes follow up on these medical concerns, but are we also reaching out to the medical providers and saying, hey, we're going to have an epidemic here probably in the in the next 3 to 6 months, but what type of outreach are we doing for the medical providers?
Well, from the clinical's point of view, I would say that we are aggressively trying to bring clinicians down over here. Yeah. But also, one of the things that has been mentioned in our conversations with the managed care companies, Molina as well as the California Health and Wellness, is that they have mandates by the state to have a certain number of group of clinicians, specialists in primary care as part of their provider network. And that's why I think they are also talking about transportation, so in case we don't have the services here, then they will be able to provide transportation to wherever the services may be available. But as far as clinical goes, we are aggressively trying to recruit more people, and our stopgap plan is to have extended hours, for the permanent primary care specialists. Both the managed care companies are talking to the specialists to have them what we have right now is even for the specialties that don't take Medi-Cal in their offices, we have contracts with some of them that they actually come to our sites and provide services. So they are not billing for them, we are billing for it and we pay them. So those are some of the strategies that we have used so far. And you're right, I mean, it's going to be something that we will all have to work with and make sure that we are able to provide services to the present group and the new group that we anticipate that's going to come in.
Thank you.
And also, Robin's not here. I think she's working with the medical community as well and the managed care plans, and they've shared with us that there are specialty providers out in other our neighboring counties, and that's why you might want to pick a plan if you have a particular medical issue where you need a specialty care in another county, for example, San Diego County, then you would want the plan that also provides transportation to that provider. Yes, they are. So they are working on it.
Oh.
Roger, question. Do we have any of the HMO representatives here from California Health and Wellness or Molina that we can ask technical questions of?
No,
And if not, that would be something for Alliance to do. That we really need the technical people down here.
Okay, do you want to make a comment,
Well, that's exactly what I was gonna say.
Okay, her turn.
What did you
I'll
say?
get back to you, sir.
My question is for Peggy. Currently with the
Speak
hospital
loud,
and patients who come in, they have questions about share costs, they have questions about other healthcare coverage that shows on their Medi-Cal or CMSP eligibility. When we try to contact social services, it's kind of difficult for us to provide service for the patient. With these new changes, are you guys gonna make something available where we can call and not have to struggle or send the patient to DHS, come back with the information so that we're not sending patients back and forth?
Well, we might have to see the patient, unfortunately, but again, like we said, we'll work with you. There's certain things they are going to need to see an eligibility worker now. Can I get an eligibility worker out there? That's something that we'll talk about. It's about resources for us and any needs that what we're being also asked to do by the state is an integration of services. So if they come in, now they're interested in Medi-Cal because now they might qualify, is now, it's part of our culture change, is it's not that you're not eligible, it's, okay, well, what are you eligible for? So that's our role as well. So we will work with you. If you've had difficulty getting questions answered, we're working on that to be able to streamline things, like I said, a phone bank or something where you can call, such as 211, a mini version at our department. We'll talk about the resource room where you can go in and get information that you need. You can go online. Now, you're talking in terms of a patient actually at your hospital that you want to know if they can get the service that they would get going into our office.
Well, what I mean is, like, for example, if I have run somebody's Medi-Cal eligibility and it comes up with a social, and we need to bill with the actual BIC number, if we don't have that information, we can't bill Medi-Cal or CMSP. So if I call social services, it's like, oh, I'm sorry, I can't provide that.
So I think what needs to happen, and several of you have brought it up, is that we will have different venues for the different questions that are being asked, very technical questions regarding eligibility, share of cost. For those healthcare providers that are out there that are sending their billing staff, we can have a separate meeting on that. And I'll have the folks here that I need to have with me to answer those questions. And I think we'll be working together to do that, to set up those different venues as part of our outreach. Yes. Yes.
We don't even know sometimes.
Right, right.
Ken Whitens with United Way, and this question goes to Peggy and to 211. The county has several agencies involved, not only in health, but other types of welfare agencies. And have all those agencies, do they need to, and have they all registered with 211, to your knowledge, John?
We're working on it.
We're working on it. We want more. Yeah. We need more. Yeah.
Because there's programs that are available that I don't know about, and if I refer the people to you and they're not registered, and that's, like all the, you came down and when you put on the presentation a few months ago, it was encouraging all the agencies to register with 211 so you get a better database. So that's something that is being worked on.
Yes.
Yeah.
Okay, you're next.
Okay, one of the questions that he said that we're gonna do outreach to Mexico, but isn't that the number one regulation to apply for Medi-Cal or the new managed care, is to be a resident of the United States or the resident of? Don't you have to be, because
You
he's
have to be
asking
a-
for research, outreach to Mexico, but people that live in Mexico, even if you're a US citizen and live in Mexico, you're not eligible. So that's not gonna change, right?
But there's people that live part-time in the US because they work here, they go to Salinas and they live there for months and they work in Coachella, depending where they go.
But
their
no matter
job.
what, you still have to be a resident of the United States. Or,
You have to have residency.
Residency.
That is part of the eligibility.
yes, that's the
So,
number one.
I think what the question is, you know, again, different venues, but, yeah, you have to be a resident. There's eligibility requirements. I
Yes.
think it was a different situation.
Because he's asking if we were
Yeah,
getting something to
resident
Mexico, but
more than
we don't.
5 years, or citizen, because a lot of citizens live in Mexico and work here too. But you have to be resident at least 5 years or more, or citizen. Yeah, and you qualify. You can live in Mexico, but you're working here. And you qualify.
Well, if you're here illegally, you're here illegally.
Exactly, that's another issue.
Wait, Araceli, she was next.
No, just to clarify what her concern. Just to clarify, everyone that applies for medical, it is either a resident for one city or another one, but in this county. The reality is that we do have seniors and we do have health problems in our community, and these residents, they might stay with family relatives across the border, or they might come, but we're not talking about the eligibility of Medi-Cal. I think that we're talking about the different programs and plans under the Medi-Cal.
And this is just an update from the Assembly Member's Office, and that was really kind of like to piggyback on the question that this gentleman over here asked about underserved doctors here, or basically the number of doctors that we have here in the community for underserved needs. Yesterday, Assembly Members Bill AB 1288, the governor just signed it. So that's kind of like one of the solutions, a small solution, just the beginning, but it'll pass. It just passed. It just got signed into law, and just wanted to give
What is the bill? What's the bill?
AB 1288, and this is for underserved, for physicians in underserved areas, so that they're able to kind of, give a little more of a solution as basically to help a little more physicians come into the area.
Bring more physicians.
Right. And it's specifically for underserved
Areas.
Can you repeat which one is, so that we can read them?
AB 1288. And that was just a little update.
Thank you.
Anybody else? All right, well, thank you very much. Let's give a It's only the beginning. We're going to continue the dialogue, and we're going to be sending out information as we can. Thanks again.